Hello, Dr. Fisher here. Let's talk about postoperative pain control. How I wish there was such a thing as surgery with no pain, but unfortunately, it doesn't exist. How patients deal with their discomfort is a very personal thing, but there are a lot of things that we do from our end to help patients through this whole experience. And we don't want you suffering in a lot of pain for two reasons. The first reason is we don't want you suffering in a lot of pain. The other reason is that patients who are in a lot of pain aren't really getting up and moving around like they need to. Being mobile after surgery, getting up and walking even the day of surgery is one of the most important things that patients can do to prevent themselves from getting very serious complications like blood clots in the legs or pneumonias. These things almost never happen as long as people are up and walking around and mobile after surgery. And one of the easiest ways to make people feel better and able to do the things that they need to do is having good pain control. What I have found is that using narcotic pain medicine, medicines like Percocet or Vicodin, really helps patients for those first 2 or 3 days when the discomfort is the most. Over-the-counter pain medicines just don't seem to manage the pain as well for most patients. So my recommendation for patients is for the first couple days, the first 2 or 3 days, take the pain medicines that we prescribe you and take them on a schedule. The advantage of that is that you have a level of the medicine in your system, and that will really control your pain much more. If patients try to wait and see how things are and they're in a lot of pain, then no pain medicine is going to be able to control that. You don't want to get behind. We want to stay ahead of things. If you find that you don't need as much pain medicine, it's better to spread out those pain medicines but keep them on a schedule, at least for those first 1, 2, or 3 days after surgery. Because we want your pain well controlled, we want you to be as comfortable as possible, to be as safe as possible, and have the best experience right after your surgery. It's the middle of the night, or it's Sunday, and you have a medical emergency. What do you do? Well, if it's a true medical emergency, you need to call 911 and call them as fast as you can. Please notify the office after you've done that so that we can at least follow your progress and we can meet you at the hospital. If it's anything else, call me first. I am available 24 hours a day, 7 days a week to answer my patients' questions. There is no question that is too small. And 99.999% of the time, what patients are worried about after surgery are things that are normal after surgery and don't require attention in the emergency room. If you call 911, the fire department will be there in 2 or 3 minutes. They are incredibly responsive in Miami. And I have a lot of respect for the fire department, especially now. They are amazing heroes who are incredibly overwhelmed, and we don't want to add any burden to them. If they get to your house or your hotel, even if you're totally fine, they're going to take you to the hospital anyway. Well, that's what they're supposed to do. They're supposed to stabilize you and transport you to a hospital setting. Once you get to the emergency room is also overwhelmed these days, and they're going to do a lot of things. They're going to get a CAT scan and an ultrasound. They're going to cut off your garment with scissors. They're going to usually admit you overnight or for longer to the intensive care unit, and most patients will get a blood transfusion. Patients almost never need an emergency blood transfusion, but in a hospital setting, they almost always give patients blood transfusions, and I don't blame the hospitals for doing what they do. Emergency room doctors and hospitals don't understand our patients the way that we do. They don't understand what is normal and what's not normal, and they tend to do things that we wouldn't necessarily need to do for our patients. We can answer your questions a lot better than the hospitals can. And unfortunately, a lot of times patients end up with a huge bill because not only are the services in a hospital, but they're in an emergency room. And even if you have insurance, a lot of the times, the insurance company will only cover part of the bill. Sometimes the insurance company will reject the entire bill. So don't hesitate to call the office. If for whatever reason we decide that you need to go to the hospital or the emergency room, or if you need a diagnostic study that can't wait until the next morning or till the end of the weekend, I'll at least be able to tell you which hospital to go to. I can send you to a hospital where I have privileges, so I can be the doctor taking care of you and making your decisions. And I can call ahead to the emergency room and let them know that you're coming, tell them what we're looking for and why we're sending you there, which will help them focus the types of exams and the types of things they're going to do for you so they don't put you through a bunch of unnecessary and extra tests.